Coronavirus cases are exploding in California. The state set new records, including seeing more hospitalizations than ever before. Yesterday, state health officials reported 35,400 new cases and brings the total number of cases to more than 1.3 million. Officials also reported 219 deaths. That breaks the record set in July and brings the number of deaths to more than 20,000. Hospitals across California are stretched to their limits. They are treating more than 10,000 COVID patients. To talk more about the current situation in California is Jeremy White, co-author of the California Politico Playbook. Hi, Jeremy. Welcome. Great to have you with us. So California is the hardest hit state right now when it comes to COVID. Can you expand on the current situation there?
Certainly. So the governor, Gavin Newsom, indicated last week that most of the state was going to be going back into a stay-at-home order like we saw in March. This time around, it is tied to intensive care unit capacity, and any California region that drops below 15% capacity goes back into the stay-at-home order, which is effectively everywhere in California at this point. So these types of restrictions have always been designed not just to limit cases and deaths, but to relieve the healthcare system so hospitals don't become overwhelmed.
So, Jeremy, can you talk a little about the state's regional stay-at-home orders? Which areas are affected? You know, who's being told not to do what?
Certainly. These stay-at-home orders affect the entire state at this point. ICU capacity everywhere has dropped below 15%. And so Californians are being urged, as they were in March, to remain in their homes unless they have necessary shopping to do. This doesn't apply to essential workers, but the message from health officials and elected officials from the governor on down is don't go out in public and gather unless you can avoid it.
And are officials hopeful that these stay-home orders will be effective like they were in March? And is there any discussion of what will happen if they're not? Because, of course, this time around, there's a lot more fatigue, correct?
That's right. I think California got a lot of credit back in March for instituting America's first statewide stay-at-home order, which really helped avert that hospital crippling surge that people were afraid of. There's hope that stay-at-home orders will have similar effectiveness this time around. But as you noted, we're many months into this. People are weary. They are really alarmed. Businesses are by even outdoor dining and things like that closing. So officials are hoping that this will do the trick as it did back in March. But I think Californians' patience and stoicism is really being tested, as has been the case with Americans around the country.
And do we know yet what the state's vaccine distribution plan is?
So the state is essentially doing a tiered vaccine distribution plan, sort of a hierarchy of needs. So the first round of doses will go to people like frontline healthcare workers who face the highest risk. So we are expecting the first batch of about 300,000 doses to arrive in California within the coming days. And Governor Newsom said earlier this week that we can expect somewhere in excess of 2 million doses to arrive this month. Keep in mind, though, that given that people need multiple doses, that really looks like probably about 1 million or so Californians who would get vaccinated out of roughly 40 million. So good news that the initial batch is coming, but as the governor has stressed for weeks now, this is going to be a long slog, and we are not going to be seeing the sort of mass vaccination required for herd immunity for many months.
Still going to be a long winter, even in sunny California. All right. Well, Jeremy White, co-author of the California Politico Playbook, thank you so much for joining us.
Thank you.